warm welcome to the nursing capsule videos. Today we are just going to discuss with a topic what is called pleural effusion. So we know that the definition of pleural effusion is water on the lung. It's not that water in the lung, because it's not inside the lung, it is around the lung. That is what is called pleural fluid. Let's know about the anatomy of the lung. The lungs, like it's two lobes mainly, right and left. Okay, the right one is being divided into three lobes and the left is divided into two lobes. Okay, let's see the covering. The outer covering of the lung is called the pleura. Okay, and the inner layer is called the visceral layer. In between this one, there is a fluid called pleural fluid, which helps in the normal movement of the chest walls. Okay, so when this fluid, normally the pleural fluid is 5 ml, and when this amount of fluid is increasing, our lungs cannot expand and relax normally. That situation is known as pleural effusion. Okay, so what are the causes of pleural effusion? Congestive heart failure. We know that when the congestive heart failure happens, the heart is not pumping properly, in which the fluid balance cannot be maintained. So that time it can lead to pleural effusion. Then the other cause is cancer, pneumonia, pulmonary embolism. Emboli blocks the lung so that exchange of gases doesn't happen. Then infections like TB and liver and kidney diseases also in fact causes pulmonary effusion, because of these diseases water and electrolyte is not being getting drained out, or it's not purified, or that balance is not happening in the body. Because of that, even that can happen to pleural effusion. What are the main signs and symptoms of pleural effusion? Is pleuritic chest pain. Pleuritic chest pain means a chest pain that increases with inspiration. That is called as pleurisy or pleuritic chest pain. And then dyspnea. Okay, decreased breathing difficulty is there, and decreased movement of chest wall in the affected side. Okay, usually when we do the ultrasound, we can see that which part this fluid is getting collected, either it's right or left. So in case if the left side is being affected, the movement of the left side of the lungs will be less. Okay, then tracheal irritations will be there. Because of the tracheal irritation, dry and non-productive cough will be there. The main signs and symptoms of pleural effusion is tachycardia and tachypnea. Why this tachycardia and tachypnea is caused? The affected side, in the affected side, decrease or absence of the breath sound will be there due to increased fluid collection. The visceral area shift inside to the normal lung side. So there is decreased oxygen entry spaces that causes the tachycardia or tachypnea. So in case the lung, this part is getting affected, so what happens is because the fluid collection here is increasing, so it pushes towards the unaffected side. Okay, so the unaffected side also the space will get reduced, so there is decreased entry of oxygen into the lung, which causes tachycardia and tachypnea. These are the two main signs and symptoms of pleural effusion. There are two types of mainly pleural effusion. One is exudative and transudative. Exudative is mainly the fluid is protein rich. So what are the causes for that one? Is pneumonia, kidney disease, cancer, TB and pulmonary embolism. Transudative is watery fluid. What are the causes? Is heart failure, pulmonary embolism, cirrhosis and open heart surgery. So these are the two main types of pleural effusion. As most of the people who work in the ICU and all, that they will be having this thoracosynthesis will be done, and the fluid will be taken and they will be sent for analysis. So with that they will be by analyzing the pleural fluid, they will be able to find out what type of fluid is that, and from that what causes this fluid production. So accordingly they can treat the management plan. Okay, the diagnostic evaluation for the pleural effusion is chest x-ray, ultrasound and CT scan. Management mainly thoracosynthesis. Thoracosynthesis is a procedure in which, a sterile procedure in which a needle which be inserted into the pleural space. So which side the needle has to be inserted, it will be decided by the doctors depending upon the fluid level. Okay, so usually like they are telling 8 intercostal space or 9 intercostal space. Okay, in general let's understand that we have 12 rib gauges, okay, ribs, and 11 intercostal spaces. So in between the spaces only they are inserted, not into the ribs, definitely into the intercostal space the needle will be inserted, so that this fluid can be drained out. So that procedure is called thoracosynthesis. And then like in case if the fluid production continues and if it's more, they will just go for ICD, that is intercostal drainage system. So intercostal drainage system, in further video we will discuss in detail. Okay, it will be connected continuous drainage to a chamber. Okay, so what are the nursing points, what we have to keep in mind and all will be discussed in that video. And then in case this pleural effusion, if it's coming recurrent, they are going for pleuridosis. Pleuridosis is using the ICD, they will drain out the fluid first and then they will use chemicals or drugs will be injected into the pleural space, which causes the inflammation of the pleural space and which results in the adherence. This visceral layer and parietal layer will get adhered to each other, so that this production of the pleural fluid will be minimized. What is the nursing diagnosis is high Fowler's position, okay, to increase the thoracic space. Oxygen administration is needed, deep breathing and coughing exercise. That's all for with the pleural effusion. Thanks for watching the video. See you again with more videos. Thank you.